Hey everyone, welcome back to Health Noble. Low carbohydrate foods have been questionable for some time. Some classes of people affirm that these foods increase the cholesterol level in the body and induce heart disorders because of their massive concentration of fat. However, in some vital experimental researches, low carbohydrate diets demonstrate their value as healthful and useful. Today, we are going to be talking about the benefits of keto diet. But before we start, make sure to subscribe to our channel and hit the bell icon to be notified when we post a video. Make sure to stay until number 1 as you don't want to miss this unique topic, benefits of keto diet. Let's get started. Number 10. Keto diet reduces appetite. Hunger can be one of the worst impacts of nutritional therapy. It's the primary reason why the majority of people feel sick. Nonetheless, a low-carbohydrate diet can lead to an unconscious decline in appetite. A recent survey shows that if people reduce starch and consume more proteinous food and oil-rich food, they turn out to be consuming fewer calories. Number 9. Keto diets lead to more loss in weight. Reducing the consumption of carbohydrate consumption can be regarded as one of the most comfortable and most efficient methods to drop weight. Researchers show that the person on low-carbohydrate foods manage to lose weight quicker than folks on low-fat intakes. This is as a result of these meals appearing to discard excess liquids from the body, reducing insulin levels and resulting in rapid weight decline in the first few weeks. In an analysis examining low carbohydrate, people restraining their carbohydrate consumption sometimes lose about twice as much weight as they have before. One research on overweight grown-ups discovered that low carbohydrate food intake is expressively beneficial for up to 3 months, contrasted to a popular weight loss diet. Henceforth, the variance in weight decline within foods was trivial. In research, in 800 obese grown-ups on a low-carbohydrate diet or food intakes, both groups lost similar amounts of weight. In studies comparing low-carb and low-fat diets, people restraining their carbs sometimes lose 2 to 3 times as much weight, without necessarily being starved. One study in obese adults found a low-sugar diet particularly useful for up to 6 months compared to a typical loss in weight diet. After that, the difference in a loss in weight between foods was insignificant, and a year-long study in 609 overweight adults on low-fat or low-carb diets, both parties lost comparable volumes of weight. Number 8. Ameliorates acne. Consuming a diet high in treated and processed carbohydrates may modify the body's bacteria's stability and cause the sugar content in the blood to rise and drop significantly, which can negatively affect the health of the skin. According to a 2012 research, decreasing your carbohydrate consumption, a keto diet could also reduce the symptoms of acne in some people. Number 7. Reduces the chance of some cancers. Researchers have studied the consequences of the ketogenic diet in aiding, preventing, or even treating certain types of cancer. A study discovered that keto diets might be a reliable and suitable equivalent to therapy with chemotherapy and radiation therapy in people with certain types of cancer. This is because it would induce more pressure in the cancer cells than in the healthy cells, making them die. Current research from 2018 infers that because ketogenic lessens blood sugar, it can also reduce the risk of insulin complexities. Insulin is a hormone that regulates the sugar levels of the blood that could have ties to some cancers. Although some studies show that the ketogenic diet may benefit from cancer treatment, studies in this area are limited. Researchers need to carry out further investigations to thoroughly know the ketogenic diet's possible advantages in cancer remedy and therapy. Number 6. Improves heart health. When you follow the keto diet, it is imperative to choose healthy foods. Some data shows that consuming healthy fats like avocados rather than less healthy fats such as pork rinds can enhance the health of the heart by decreasing the cholesterol level of the body. A 2017 analysis of studies of humans and animals on a keto diet revealed that some people felt a notable drop in total cholesterol, bad cholesterol, and an improvement in high-density lipoprotein. High levels of cholesterol can enhance the risk of cardiovascular disorder. A keto diet decreasing effect on cholesterol may lessen a person's chance of heart complexities. However, the study resolved that the diet's definite influence on the heart health depends on the quality of the menu. Therefore, it is essential to eat naturally healthy and well-balanced food while following the keto diet. Before we continue with the other half of this video, don't forget to subscribe to our channel Health Noble. It really helps us out. Number 5. Keto diet reduces seizures. The proportion of protein, fat, and carbohydrate in a keto diet changes how the body utilizes energy, giving rise to ketosis. Ketosis is a result of a diet that is very low in carbohydrates. The Epilepsy Foundation recommended that ketosis decreases seizures in people with epilepsy, particularly those who have not reacted to other therapy methods. More studies are required on how efficient this is, though it seems to have a significant influence on children who have focal convulsions. In 2019, analysis strengthens the theory that keto diet can aid people with epilepsy. The keto diet may decrease epilepsy signs and traits by several diverse mechanisms. Number 4. Reduces inflammation. Inflammation is the natural condition in which some portions of the body become colored, swelled, and frequently painful, notably in response to an injury or infection. This is the body's typical reply to an alien substance it considers dangerous. Persistent inflammation and process that forces your body to pump out fiery chemicals for days continually and months. This is majorly the reason for most recurring diseases, including some cancer type, diabetes, and some heart diseases. Make sure you're eating complete unprocessed meals when on a keto diet. There are various types of keto diets. Some keto diets are low in carbohydrate but still full of inflammatory foods. Your best anti-inflammatory method is to maintain suitable lipids, grass-filled protein foods, and fresh natural vegetables. Number 3. Keto diet reduces blood sugar and insulin levels. Low sugar foods and keto diets can be particularly useful for persons with diabetes and insulin immunity, which afflicted a whole lot of people globally. Researchers have proven that lowering the consumption of carbohydrate foods reduces both insulin levels and blood sugar severely. In research on people with adult-onset diabetes, 85% had decreased or eradicated their dextrose-lowering pills within 3 to 6 months. If you are on blood sugar pills, speak to your consultant before initiating adjustments to your carbohydrate consumption, as your prescriptions may be required to be modified to prevent hypoglycemia. Number 2. Serves as a remedial for several brain disorders. The brain requires dextrose, as sections of the brain can only melt this kind of sugar. That's the reason your liver manufactures dextrose from proteins if you don't eat any abundant foods and carbohydrates. A large portion of the brain can also consume ketones, which is produced during a hunger or when your carbohydrate consumption is deficient. In a lot of cases, this food can serve as a remedy for children with seizures. In a research, more than half of the kids on keto diet felt larger than a 60% decline in their number of people with epilepsy, while 20% became epilepsy-free. Very low sugar foods and keto foods are now examined for different brain ailments, including Alzheimer's and Parkinson's disease. Number 1. Keto diet strengthens the brain. Ketones, chemicals the liver produces when the body doesn't have enough insulin in your body to convert glucose into energy, provides the brain with immediate fuel. Ketones are so vital that they can supply up to 80% of the brain's energy demands. Majority of the fat on keto diet supply the brain and keep it sharp. The brain houses the fattiest organs in the body, which make up more than 60% of fat. Researchers have shown that switches to keto diets can protect the brain from cognitive decline and increase retention. In one research, women on a low sugar consumption responded more swiftly during an alertness test than women on reduced calorie nutrition. In another study, older men and women at danger of memory loss were placed on a keto diet. After about 5 to 6 weeks, they showed enhanced memory functions in comparison to other folks on high carbohydrate diets. Well, that's it for today's video. If you like it, make sure to hit that like button. And don't forget to subscribe to our channel Health Noble and to click on the next video.